Hi, my name is Greg Fell. I'm Director of Public Health at Sheffield. This is this week's Epidemiology and Situation Report. So epidemiology first. Currently our 7-day rates are trending well northwards of 300 per 100,000. About 1,200 people tested positive last week, and all up the prevalence is about 2.2%. Now that's important, but roll back 6 weeks, prevalence was less than 50 per 100,000. And 0.2% of the population were infected. Almost all of our cases are 12 to 35, 12 to 40 year olds. So we've got a really high case rate and going up, with about a third of the population being particularly susceptible, 2/3 now being protected by vaccination. Vaccination has weakened but not broken the link between being a case and being in hospital. There's a slight uptick in hospitalisations, and I expect that will continue. So obviously something to be careful about. The best articulation of the epidemiology is the REACT study. Infections have recently increased fourfold from 0.15% to about 0.6%, and all up about 1 in 170 people are infected. Really importantly, the REACT study told us that the case rate in those that are vaccinated is 3 times lower than the case rate in those that aren't vaccinated. What people are telling me, lots of services are telling me it's really hard to run services due to absence. Lots of cases, lots of contact, lots of people isolating. The NHS is saying it's hard. Schools and education sector are telling me it's hard to run businesses. Actually, the hospitality sector is telling me it's pretty hard to run pubs because they're losing staff. Businesses want a careful exit because businesses don't want to go backwards, and I think that's really important. We need to keep a careful watch on that one. So then on to the future. My worry list for the future is fairly constant, and there are about 4 or 5 things on the worry list. Firstly, the roadmap will most likely end on the 19th of July. COVID will not. COVID will be with us for a long time to come yet. So more specifically, long COVID. Look at the data on the Office of National Statistics website, both on the epidemiology and the impact. It's very sobering. The best way to avoid long COVID is to keep community infection rates really low. Running services without all the staff being off isolating, as I've said, it's an issue for the NHS, hospitality, schools, education, pretty much everyone, and it's a big deal. Variants and variants of concern. We've got lucky to date with the variants of concern in terms of no immune escape. We may not be lucky next time, and we don't want to be in this situation where we've got a transmissible variant that the vaccine doesn't work on. And then on vaccine, we've done a really good job as a city getting people vaccinated at some considerable scale quickly. There's still many tens of thousands of people aged over 50 that don't have the first jab, and there are still more than 100,000 people all up who aren't fully vaccinated. Whilst we've done well, we've got a long way to go there. So the government has signalled that its intention is for us that we would live with COVID. I think it's unlikely that the 19th of July will not stick. And it's probably, from a government perspective, the least bad of the various options. So we will be learning to live with COVID for quite some time to come. It's important that people don't mix lockdown with interventions. There will be public health interventions to control the rate of COVID for some time to come yet. That is not lockdown, and we're trying to avoid anything akin to lockdown. We will focus our energy on the things that are most likely to keep the spread low. Most importantly, self-isolation of cases. Face coverings, especially in crowded places, have made a massive difference. We'll work on a pragmatic and workable COVID secure standard, including working from home as much as possible. We'll be vaccinating at speed, and we'll be preparing the education sector for the response in the autumn term when that comes. But all up, we'll be in this space for quite some time to come. Common question in my inbox over the last couple of weeks is, why can't my school have a prom or a sports day or a graduation when tens of thousands of people can go and watch the Euro finals at Wembley? I should explain the rationale. A few weeks ago I advised schools against non-essential educational activities. The advice was a recommendation to school, and each school has to make its own decision based on those circumstances, but I support schools that will make decisions. Rationale: the Delta variant is dominant now and is highly transmissible. The secondary attack rates are much, much higher than the Alpha variant. What we're seeing is where there had been an outbreak with 2 or 3 cases, we're now seeing 20 or 30 cases and then some, and sometimes much, much bigger. As a result, kids isolating, parents isolating, teachers isolating. We're seeing big growth in large outbreaks really very quickly. We're seeing exponential growth of cases, doubling of case rates every 6 days or so, particularly linked to school settings. And we're wanting to do all we can to protect those that are as yet unvaccinated and ensure that we get to summer as safely as possible. The case rate's definitely proving a problem for children. Large numbers are isolating, missing their education. For schools, teachers are isolating, not able to teach, and other school staff not there. And for parents who have to take time off work to look after isolating children. So we want to do all we can to protect essential education and to limit the case rate as much as we can, and clearly there's some difficult balances in there. Schools have asked us for a single citywide position, so therefore the recommendation that I made was for a single citywide position. And I'm also a little bit nervous about the impact of long COVID on young people. We don't know all that we need to know about long COVID. It seems to be there. And even if a small percentage of children that become infected develop long COVID, a small percentage of a large number is a large number. I understand all of the contradictions with regard to the planned lifting of restrictions at national level, with regard to tens of thousands of people watching the football last night in Wembley Stadium. That will have an impact on case rates, no two ways about that. Equally, one of my responsibilities is to make sure we do all we can to limit the case rate in Sheffield. Therefore, I did recommend that we don't do non-essential educational activities.